Did you know most heart attacks don't strike without warning? Your body whispers long before it screams. Millions overlook the early signs until it's too late. But you don't have to be one of them. In this video, we'll show you how to prevent the heart attack before it ever happens. You'll learn how to avoid a heart attack using real-life examples, early warning symptoms, and the latest myocardial infarction drug treatment options. Whether you're managing risk or protecting a loved one, these insights could save a life. Let's take heart health seriously. Here's how to prevent from heart disease starting now. 1. Unusual fatigue. When tiredness isn't just tiredness. I thought I was just getting older, but now I'm rethinking everything, a viewer wrote. Fatigue is one of the most commonly ignored warning signs of a heart attack, especially among women. It's not the usual end-of-the-day tiredness. This is the kind of exhaustion that feels like you're dragging through the day, even after a full night's sleep. You might struggle to walk short distances or feel winded just climbing stairs. What's happening? Your heart might not be getting enough oxygen-rich blood due to narrowed arteries. The key? Don't brush it off. If you're constantly exhausted for no clear reason and you're over 40 or have risk factors like high blood pressure or diabetes, it's time to act. This could be your body's early alarm, a silent scream before a heart attack hits. And this is exactly where knowing how to prevent the heart attack truly begins. 2. Shortness of breath, a sign that your heart is struggling. Imagine this. You walk up a short flight of stairs, and suddenly you're out of breath. No chest pain, no obvious cause, just a tight, uncomfortable need to sit down and rest. Sound familiar? This isn't just being out of shape. It could be one of the most overlooked signs of a heart that's not getting enough oxygen. As arteries narrow, the heart has to work harder to pump blood. That strain shows up in your lungs first, making it feel like breathing is harder than it should be. Several commenters shared that they'd felt this but thought it was aging or anxiety. One even said, "I didn't think shortness of breath had anything to do with heart disease. I was wrong." If you've been wondering how to avoid a heart attack, start by listening to your breath. It may be trying to tell you something vital. 3. Jaw or upper back pain. When the ache isn't what it seems. My loved one never had chest pain, just jaw tension and fatigue. We almost missed it. That comment hit hard. Why? Because it's common and often fatal. Pain from the heart doesn't always show up in your chest. In women especially, it can radiate to the jaw, neck, shoulders, or upper back. These areas share nerve pathways with the heart, so the brain can mislabel where the pain is coming from. You might feel tightness in the jaw or a dull ache between the shoulder blades. It might come and go or feel like muscle soreness that never quite goes away. Here's the key. If the pain is new, unusual, or persistent, and you have risk factors, don't assume it's muscular. It could be your heart talking. Learning how to prevent the heart attack means recognizing that sometimes the heart doesn't hurt where you expect it to. 4. Digestive discomfort, when it's not just indigestion. Bloating, nausea, mild stomach pain. For many, these seem like routine digestive issues, something you'd blame on a heavy meal or stress. But here's what you need to know. In older adults, and especially women, digestive discomfort is often a hidden sign of heart trouble. Why? Because the heart and digestive system share nerve pathways. When the heart is under strain, it can trigger symptoms that feel like indigestion, but actually stem from reduced blood flow to the heart. One viewer wrote, "I had stomach bloating and pain after meals for weeks. Turns out it was cardiac." So if you experience persistent bloating, fullness, or pain during light activity, don't assume it's your gut. If you're wondering how to prevent from heart disease, listening to your stomach might be a strange but life-saving first step. 5. Dizziness or lightheadedness, the warming that feels like nothing. How many times have you stood up quickly, felt a little dizzy, and shrugged it off? But here's the catch. When dizziness happens during rest, light activity, or without any trigger, it's not something to ignore. It may indicate low blood flow to the brain, caused by a weakening heart or narrowing arteries. Several viewers described experiencing these random dizzy spells. One even said, "It started happening while I was eating." If you're feeling faint, especially while walking, climbing stairs, or during emotional stress, your heart may be struggling to deliver oxygen where it's needed most. So if you're serious about learning how to avoid a heart attack, don't dismiss dizziness as nothing. Your body knows when something's off. Listen to it before it has to scream. 6. Cold sweat and pale skin. Your body's silent SOS. Cold sweat out of nowhere, sticky, clammy, and completely unrelated to heat or exercise. Sound familiar? One viewer wrote, "I had this strange sweat while sitting at my desk. No pain, just a weird chill. I ignored it. Later, I found out my arteries were nearly blocked." Cold sweating and paleness are classic signs of the sympathetic nervous system reacting to cardiac stress. Your body knows something is wrong before you do. It's trying to cool itself, lower blood pressure, and keep the heart stable, a desperate survival attempt. If you've been wondering how to prevent from heart disease, recognize that sweating at rest, especially if it comes with lightheadedness or fatigue, is never normal. Take it seriously. When your body sends an SOS, don't hit snooze. 7. Numbness or pain in the left arm, the classic signal you should never ignore. You've probably heard that left arm pain is linked to heart attacks, but what does it really feel like? Some describe it as a dull ache. Others say it feels like tingling, heaviness, or mild burning. It often appears during activity, like walking, climbing stairs, or even after stress. One viewer wrote, "I kept feeling this strange numbness in my arm while walking. No chest pain, so I ignored it. Now I wish I hadn't." Why is this so critical? Because your heart shares nerve pathways with the left arm. Pain or numbness there can be a red flag of reduced heart function. If it's new, unexplained, or comes with fatigue or dizziness, go see a cardiologist immediately. Don't wait for the big one to make it obvious. This is your body's final warning, and knowing this is how you prevent the heart attack that could end everything. Let's be clear, a heart attack doesn't always start with chest pain. Sometimes it starts with fatigue, or shortness of breath, or a strange pressure in your jaw. Your body whispers before it screams, and when it comes to your heart, those whispers matter. Today, you've learned how to prevent the heart attack by recognizing the 7 early signs. You now know how to avoid a heart attack, not just with medication, but with awareness, action, and regular care. If you or someone you love has felt any of these symptoms, don't wait. Talk to a doctor. Ask about preventive screenings. And if you're high risk, ask your physician about myocardial infarction drug treatment options. Like this video if you found it helpful. Share your experience in the comments. Your story could save someone else. Send this video to one person you care about. You might change a life today. And remember, you don't need to wait for a heart attack to start taking care of your heart.